Asian eyelid surgery. Incision too high? I am 12 days post-op, and I know I'm still swollen, and that the crease always looks a bit too high at first, but my incision looks ridiculously too high. Keep in mind that I wanted a natural-looking crease for Asian eyes, 2 millimeters max. My mom had hers done, and even she says the incisions look too high.
Thank you for your question. You submitted several photos and you state that you're 12 days after Asian eyelid surgery and you are concerned that the eyelid creases are too high. And you also state that your mother, who also had the same procedure done, feels the same way. You state also that you wanted to see just 2 millimeters of eyelid for it to look natural, and so clearly you are distressed and concerned. Well, I can certainly give you some understanding of how a surgeon approaches Asian eyelid surgery. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize in Asian eyelid surgery amongst several other areas, and I am certainly familiar with this very important concern of looking natural. So, to begin with, I think it would be fair to assume that you did choose a doctor who showed proficiency in performing Asian eyelid surgery. And I would also expect that you had a good, thorough discussion about what the desired outcome will be. Now, that being said, I'll explain to you kind of my thought process when I meet a patient, and almost always the same concern is expressed. I want to look natural. Great. So then the question becomes, what kind of desired outcome do you want? And then what I do is I use a simple instrument like a Q-tip, and I roll the skin and I show the patient what I think they are asking for and what I believe also for me aesthetically looks natural. Once we have essentially have a shared understanding of what the outcome, the desired outcome will be, we then discuss what approach there is going to be. Now, when it comes to Asian eyelid surgery, whether you do one of two techniques, and the two techniques that I'm sure you're familiar with, one is called non-incisional, and of course the other is incisional. Non-incisional means that little openings are made in the skin and stitches are placed in a strategic way to engage the skin and attach it to a muscle called the levator muscle. This is the muscle that lifts the eyelid, and when it lifts, it folds the skin inward. Excisional means that an incision is made and some skin is removed. In addition, if there's extra fat, then you address the fat in order to, again, engage the skin with the muscle so you create a crease. Now, that being said, I can tell you that most surgeons who do this, who have experience, will basically have a shared idea of what the patients want to have done. And the fixation can be relatively high in that it's placed at the top of the backbone of the eyelid. It's referred to as the tarsus. And it can be slightly above that or slightly or just at that top part. And when that fixation occurs, yes, you can see just 2 millimeters of lid showing, but the skin has to be folded at a slightly higher place. Now, where it is folded is where the skin folds in, but it doesn't mean that's how much eyelid of the eyelid shows. What it basically means is that's where it's anchored, the skin. Now, how much skin overlaps, that's what is the ultimate design, so that when your swelling comes down, the skin folds and overlaps. Now, that being said, it is extremely common for people to have significant swelling like yours at this stage. It is not unusual to have patients be very concerned about the eyelid crease being high. And preoperatively, I discuss this a lot. I always tell them it always looks very high in the beginning. The swelling makes the eyelid crease look high. Now, what I also do in my practice is I actually, after doing the drawing, we actually have the patients review the process and understand, and we'll even take photos and show them what my planned placement is, where the skin will be fixated, so we are all on the same page and we've communicated and we understand. This way, afterwards, whether there is a little swelling or a lot of swelling, we know what the final outcome will most likely be. So this question really is for you to bring to your doctor. And your doctor is likely to say, wait. Because right now, while your skin is so swollen, no one can make a valid prediction based on just the swelling and not knowing anything else about you prior to the surgery, as well as the details of the actual surgery itself. No one can be able to tell you where that crease will finally settle and how much skin will be overlapping. But I think that you would be impressed at how that transformation can be fairly significant in the course of a month to several months. You can anticipate that you'll have swelling, not to the same level, but swelling will be present for months afterward. I always tell patients that expect swelling to last for at least 6 months. Technically, swelling can go on for over a year, but it's, socially speaking, a month later most people look pretty good, and even a week later people are able to go back to work. And there are times, especially with limited non-incisional procedures, patients look great in about a week. So it really is very individual. In your situation, most likely in an incisional or excisional procedure, you have a fair amount of swelling, and it's understandable why it's so unsettling for you right now. Contact your doctor, discuss this, make sure that you don't feel like you don't have any options, but at least meet with your doctor to discuss this and get a sense of where you are, and really get an understanding of what your doctor's design was. And of course, ultimately you're going to have to wait this out to see what happens. So I hope that was helpful. I wish you the best of luck, and thank you for your question.